definition of the syndrome is quite ambiguous because it is defined by abnormal bowel habit with abdominal discomfort or pain. Keep in mind that there are several different subtypes of IBS, the patients that have diarrhea, the ones that have constipation, the ones that alternate, but nevertheless one of the most prominent symptoms in terms of frequency and an impact on quality of life is abdominal bloating. Abdominal bloating and other gas-related symptoms. Well, what we saw some years ago was that patients, particularly patients complaining of abdominal bloating and flatulence, they would respond very effectively using a low-residue diet. Later on, it has shown that more complex restrictive diets, low in FODMAPs, and FODMAPs refers to a series of carbohydrates of small size that are very fermentable, that these diets are also effective, but probably for the patient it's not necessary to get in such a complex dietary instructions and just with a relatively simple restrictive diet, reducing the amount of fermentable substrates, that's enough. Several studies have shown that probiotics have an effect in patients, particularly again with bloating. The patients with bloating in a few studies, when given probiotics, they had an improvement of their symptoms and also an improvement in abdominal distension. Not only probiotics, also prebiotics are effective. Prebiotics have the disadvantage that initially being fermentable, induce the symptoms, but just after a few days, in about a week, they get an adaptation of the microbiota, and then they start to benefit from the beneficial effects of prebiotics. Well, the most important take-home messages is the interest of the field. This is a field that is growing exponentially. We started this meeting, which was new, 5 years ago, and from year to year there is more people attracted into the field, extremely good research, multidisciplinary from different perspectives, not only from different basic perspective, also with different clinical applications. And I think this is the main home take message.